I think what's changed is we used to prescribe medications, add a drop, add another drop, maybe do SLT, and then if our patients were still progressing, there were no options in the middle. There was nothing to fill that gap, and so we were moving into things like filtration procedures. And those are big, scary surgeries for patients. They're big surgeries that can cause vision loss. Yeah, they lower pressure, but there's a lot of adverse events that come along with that. And what's shifted now is we have minimally invasive glaucoma procedures to fill that gap. We have procedures that are safe, that we can intervene earlier and again reduce the medication burden for our patients.
I think the role of MIGS in glaucoma management continues to evolve very quickly. It used to be that we thought of MIGS as just a stenting procedure. We know that there are so many other options besides a stent. Maybe we thought that MIGS was only reserved for people that were progressing or at the most severe stages of the disease. Really, that's not the case. I think if we can intervene earlier, before a patient is losing vision, before we're losing control of that disease, that's going to be the best role for MIGS going forward. Glaucoma is a potentially blinding disease. And I think that if we leave the glaucoma care entirely up to our patient, they have to remember to take their drops, they have to tolerate their drops, they have to go to the pharmacy to pick up their drops. If that's the only option that we give them, we're really not going to allow the patients to have the best outcome potentially. I think MIGS is a whole new space that allows us to help take control of that disease for that patient. Traditionally, in glaucoma treatment, we've talked about eye drops, laser, and surgery. Now we have this whole new space over the past decade of MIGS that allows us to intervene without having the risks of having a tube or a trab. It can be used at all stages of disease. It can be used as a standalone or in conjunction with cataract surgery. And I think that this provides great opportunities for our patients to have better outcomes. Again, looking at what is our goal. Our goal is to preserve the visual field for the lifetime of the patient while not decreasing their quality of life. MIGS plays a big role there.
So for me, the value of MIGS is, really, I feel like it gives me more control over the disease. So again, with adherence being such an issue for patients, every day we're reliant on them to take the medication that is protecting this ganglion cells and nerve fiber layer. For me, MIGS is almost like peace of mind. And I think it's filling a big gap for patients as well. You often don't think about the burden that taking a chronic medication has on patients. We know that medications have a lot of side effects. Some of them are appearance-based, so we see patients who develop eye redness, eyelid redness, changes to the physical appearance of the eyelid, over the lifetime of a medication. We also see the ocular surface under attack with our patients on chronic meds. So I think MIGS is a really great opportunity to not only preserve the optic nerve, but really preserve the corneal surface and the conjunctival surface integrity.
I think for optometrists that want to get involved with MIGS, first step, talk with a colleague that you know is already involved. Learn about the different options, learn what is being offered in your community, learn what the surgical teams that you're working with are currently doing to manage their glaucoma patients. I think that you want to understand the options. I think you want to present some of those options to your patients, and then you're going to be able to be involved in co-management of these procedures as well. First step, though, certainly is going to be education.